Ladies and gentlemen, we are back again to our presentation with Dr. Erbil Yagmur, MOMART Infertility Clinic in Istanbul. Since long time, they are our member of council, and we are working closely with IVF Center Infertility Clinic MOMART Center, and we are and our office is quite happy with working together, and we invite Dr. Erbil Yagmur to share his experience and his knowledge about how do we conduct IVF treatment for international patient topics. So I would like to give the floor to Dr. Erbil to share his experience on topics of IVF treatment. Dr. Erbil, floor is yours.
Share screen.
Yes.
Yes. Okay. And full screen. Yes.
Yes. Go ahead, please.
Yeah. I'm Dr. Erbil Yagmur from MOMART Infertility Clinic in Istanbul. I've been working in infertility area approximately 14 years, and in my career, over 10,000 babies were born, and I'm very proud of and happy with it. In 2017, I found MOMART Fertility Center with some experienced specialists, my colleagues, and I'm one of the fertility specialists in MOMART. I've been working in this area in our clinic since 2017. One of my partners, Dr. Tansel Kaplancan, who is urologist and andrologist. He is working on male infertility, especially azoospermia, no sperm patients. And he has a great experience in microtesse operations, approximately 8,000 microtesse operations he had in career. And also he used microsurgical techniques and over 3,000 microsurgical varicocelectomy operations in his career. And the other specialists in our clinic are Dr. Melike Batukan, 20 years of infertility experience, Dr. Emre Turgut, 10 years infertility experience, and Dr. Hande Yagmur is our perinatologist. We are one of the leading fertility clinics in Istanbul and Turkey. With a highly experienced medical team who provides individualized fertility care with best success rates. And over the years, our center has assisted thousands of couples from all over the world in their journey to start a family. Pre-treatment preparation is very important in our area. And we are working with very experienced international patient agents abroad. They make our job easier. Their experience in infertility area is very important for us and our patients' success. They can send all medical tests and medical records of couple to us through email or WhatsApp, and we evaluate them when they are in their country and start a planning treatment. Then we tailor a preliminary treatment plan. this this preliminary plan involves the preparation period before you come to Istanbul, before patients come to Istanbul. And patients also be informed approximate stay duration and the cost according to the treatment plan. When they come, first step is examination of an infertile couple. For women, general and special gynecological examination. General and regarding infertility. Ultrasound examination of the pelvic organs, the number of antral follicles, it reflects the ovarian reserve, and research on flora from the urethra and cervical canal, and the degree of cleanliness of the vagina. And examination is very important for our job. Examination of the state of the uterus and fallopian tubes, hysterosalpingography or laparoscopy techniques. For men, spermiogram, and if necessary, consultation with our andrologist. And the classic first step of IVF treatment is hormonal stimulation of ovaries. Hormonal stimulation usually starting on the second or third day of the menstruation. So we want our patients to be here at that days. We give fertility hormones, and these are daily injections you give yourself, usually for about 8 to 10 days. Hormone injections increase the number of eggs of ovaries produced. This means more eggs can be collected and fertilized. With more fertilized eggs, the clinic has a greater choice of embryos to use in the treatment. Step 3. The clinic will keep an eye on patients throughout the treatment. We'll have vaginal ultrasound scans to monitor ovaries, and in some cases, in some dates, blood tests. About 34 to 38 hours before eggs are due to be collected, the woman has a final hormone injection that helps the eggs to mature. Collecting the eggs, it's very important, and it's not a painful procedure because we will give some light anesthesia to the patients during this procedure. It's called sedation, and it will take 5 to 15 minutes, not very long operation. And the woman discharged from hospital 2 hours after the operation, and after operation the pain is very small amount. For men, at that day, at egg collection time, we need men's sperm. The sperm are washed and spun at high speed, so the healthiest and most active sperm can be selected. This is the video. How can we do egg collection under general anesthesia? After collecting eggs and sperm, the next step is fertilizing the eggs. We have two techniques. First one and mostly used one is microinjection. The other name is ICSI. We select one good sperm and inject that into the egg by a needle. This is called microinjection. The other technique is classical IVF technique. This is more old technique. We use that technique rarely because fertilization rates are lower than the microinjection, and the fertilized eggs, embryos, continue to grow in the laboratory for up to 6 days before being transferred into the uterus. The best 1 or 2 embryos will be chosen for transfer, not more. Not more embryos are not necessary. 1 or 2 embryos are enough. After a collection, patients will be given hormones and some other medications for preparation of uterus. Next step is embryo transfer. Embryo transfer is most important procedure because all costs, all working, all psychological, everything makes this procedure most important. A few days after the eggs are collected, the embryos are transferred into the uterus. This is done using a thin tube called a catheter that's passed into the vagina. This procedure is simpler than egg collection and similar to having a cervical screening test, so you won't normally need to be sedated. It's not painful, and usually we don't use any anesthesia during this procedure. And this is a short embryo transfer video. Yes. Look at the catheter's tip. It's coming. Right position, right time, and throwing the embryos. Finding out if you're pregnant. Once the embryos have been transferred into the uterus, patients will be advised to wait around 2 weeks before having a pregnancy test to see if the treatment has worked. If patients do become pregnant, ultrasound scans will be carried out during the following weeks to check things are progressing as expected. From the beginning to the happy end, we are with our patients. No limits, no borders. Our team, one of the members of our team is a perinatologist, and we consult every pregnancy problem with her, and she helps abroad pregnant patients from through telephone, WhatsApp, or email. If unfortunately IVF is unsuccessful in some cases, and we should try to prepare patients for this possibility. For those who achieve a pregnancy, we provide online counseling throughout the pregnancy until delivery, and for those with a negative result, we make plans for the next treatment cycle. Our support continues whatever the result is. We use some technologies to improve our success rates. One of genetic technologies help us for this, and one of that technologies is PGT, pre-implantation genetic diagnosis. There are two kinds of PGD. First one is for aneuploidy, chromosomal screening of embryos. Since 2012, we detect chromosomal abnormalities in embryos. Reliability rate approximately 95%. It's very important. It's very good progression in our area. And our genetic team is one of the most experienced on new generation PGS technologies in Turkey, and I trust them and I thank them from here. And the other PGD is PGDM. It's for single gene disorders. For example, spinal muscular atrophy or Duchenne muscular dystrophy, muscle disorders, and some anemia, some hematologic diseases. We can detect all diseases in risky patients, but in embryos, and we do this with high reliability. The other high technology test is ERA test, endometrial receptivity analysis. Endometrial receptivity array is a genetic test performed prior to frozen embryo transfer in highly selected patients. This test aims to identify the best time for your embryo transfer based on genetic testing to identify the window of implantation. Window of implantation is very important because if we have good embryos and no pregnancy, after many transfers, we use ERA test in that patient group. We believe in the efficacy of ERA testing and have been using it in selected patients for many years now. Total elective frozen embryo transfer. In some cases, instead of placing the embryos in the uterus in the same cycle, we freeze all the embryos produced, and in the following months, we make the necessary preparations while the patient is in her own country and schedule for transfer of the embryo or embryos into the uterus. Our team is one of the first to use this method. In some cases, this technique increase the pregnancy rates. And our team has very experienced in male infertility and especially in azoospermia. In azoospermic men, we have very high sperm finding rates, and if we cannot find any sperm, we can use round spermatids for injections. This is called ROSI. ROSI is a old technique, but we use this in new way, and this technique can give being a father chance in azoospermic men. As an experienced team on male infertility and azoospermia, In addition to medical and hormonal therapies, we successfully perform varicocele surgery and sperm retrieval operations, such as microtese, MESA, TESA, and PESA. Besides medical therapies related to fertility and IVF, gynecological surgical operations such as every kinds of hysteroscopy and laparoscopic operations are performed successfully by our highly experienced team. Medical travel or tourism. Benefits of medical tourism. Thousands of people around the world travel to Istanbul each year for high quality and affordable medical care. From initial inquiries, questions, and concerns about medical treatment, we are here to serve you during all phases of your care in your own language in order to ease the process of having a treatment in a foreign country. Our support program begins before you stay to ensure you are fully informed about our facility. Communication is never a barrier during your stay. Our translators in every language are here and ready. Prior to your visit, our International Patient Programs Department will provide you with detailed information about the treatment plans, cost estimates, appointment scheduling, interpretation services, VIP transportation, accommodation, and insurance eligibility. Flights, transfers from and to the airport, and accommodation are all arranged by our experienced team. Our doctors speak English fluently, and as we host many patients from all over the world, interpreters in English, Russian, Bulgarian, Arabic, Romanian, and other languages are available free of charge. We provide well-organized medical tourism experience to our patients. And thank you for listening, and thank you for kind invitation, Emin Bey.
Thank you, Dr. Erbil. If you can stop your sharing, there is several questions we need to answer to the audience coming from different countries, actually. We have, I think, four questions for you, especially on IVF treatment. This question is coming from Russia, saying that eggs donation can be possible in Turkey or not?
Egg donation is strictly forbidden in our country.
It's not possible.
Egg donation, sperm donation, and sex selection in embryos are strictly forbidden in country.
That was the second question about actually sex selection for the international patient is also the same rules are applicable.
Yes.
The third question that can we provide surrogated mother services also or not in case the mother cannot deliver?
Surrogacy is also forbidden by law in our country, and it's very difficult position for that patients.
Good. The last question actually came from Moldova, saying that if you rate your success in your clinical operation, what is your success rate in your total operation?
Okay. Our success rate depends on too many factors, including woman's age, ovarian reserve, and male factor, sperm factor. But under 35 years of age, we have approximately 65% pregnancy rate. But most important factor is women's age.
So the success is depend on different factors.
Yes, yes.
But in general, can we give success rate 60%, 70%?
In general, over 60% for
Over
all ages. But our listeners must know, if you are 45 years old, you have a 2% take-home baby rate, approximately.
Great. The last one is not a question, actually. It's come just now, thanking you from Uzbekistan, saying that we have been treated in MOMART in 2019, and now we have our baby, and we are happy family. Thank you, Dr. Erbil. Warm regards from Samarkand city of Uzbekistan.
Yeah, I'm very happy with it. Thank you very much.
Thank you very much, Dr. Erbil, sharing your experience and being with us. Hopefully we would like to host you again in our new virtual exhibition in the near future, inshallah. Thank you for joining and being with us, and for your.
Thank you very much for your invitation, and being with you is very good with us.
Thank you very much. Thanks a lot.